Hey guys, welcome back to my YouTube channel, Basic Medical Sciences. The topic of today's discussion is hypertension. So, it is a very common disease that almost every 90% of the world's population gets suffered from. So, its definition was like blood pressure that was uh, greater than 140 by 90 mm of Hg, and blood pressure at which patients become symptomatic. So according to this definition, it doesn't work properly because some patients have blood pressure more than 150 over 90 mm of Hg, but they were not symptomatic. So there is a working definition that works in today, that is that blood pressure at which the risk of cardiovascular diseases and cerebrovascular diseases increases significantly, and by treating such levels produces clear cut benefit. What does it mean? It means that any blood pressure that will increase the risk of cardiovascular diseases, that is MI, and cerebrovascular diseases such as stroke. So at blood pressure at which the risk of these diseases increases, and by treating that blood pressure provides us a clear cut benefit. Now let's go further and discuss some physiology of blood pressure. So as you all know that blood pressure is equal to cardiac output and peripheral resistance. Cardiac output is equal to stroke volume into heart rate. So what is stroke volume? Stroke volume is that volume of blood pumped by heart in one contraction. Okay, so cardiac output is equal to stroke volume into heart rate into peripheral resistance. So, and stroke volume depends on force of contraction and venous return to heart. So if we simplify this equation, it becomes blood pressure is equal to force of contraction, venous return, heart rate, and peripheral resistance. So these are the four main things on which our blood pressure depends. Number one is force of contraction, venous return, and heart rate and peripheral resistance. You know that force of contraction, venous return, and heart rate is equal to systolic blood pressure, and peripheral resistance is equal to diastolic blood pressure. So in this way, these all factor contributes in maintaining the blood pressure. So this is the physiology of blood pressure. Now let's get to types of hypertension. There are two basically types of hypertension. One is primary and second one is secondary. Primary hypertension is commonly known as essential hypertension. This one is idiopathic. There is no such cause. Almost more than 90% of world population suffers from essential hypertension above 25 years of age. And the second type is secondary. Any kind of secondary hypertension is due to some underlying disease. If there is a patient less than 25 years of age comes with hypertension, always investigate for secondary causes of hypertension. Never ever treat that patient directly on the lines of hypertension. Let's get to the pathogenesis of primary hypertension. So pathogenically, if we study, there are two main causes that cause primary hypertension. One is genetic influence, and second one is environmental factors. Genetic influence, there are two known gene defects that causes primary hypertension. First one is that enzyme that is involved in the metabolism of aldosterone. So you all know that what does aldosterone do? Aldosterone causes sodium water retention. Okay, so when there will be sodium retention, water retention, it will increase the plasma volume, and it will in return really increase the blood pressure. Second genetic cause of primary hypertension is Liddle syndrome. Liddle syndrome is a syndrome related to renal diseases. So in distal convoluted tubules, there is increased sodium and water retention that causes Liddle syndrome, and that contributes to cause primary hypertension. So this was the genetic influence. And the second factor that contributes in primary hypertension is environmental factors, that is like stress, smoking, hyperlipidemia, and obesity, etc. As I told you that secondary hypertension is always due to some underlying disease. So there are certain etiologies of secondary hypertension. First one, etiology related to secondary hypertension is renal diseases. There are certain type of renal diseases that contribute to secondary hypertension. That is renal artery stenosis, adult polycystic kidney disease, nephritic syndrome, renal failure, and there are some endocrinal disorder that causes secondary hypertension, such as acromegaly. And what happens in acromegaly, that there is increased growth hormone production, which increases vessel wall thickness, and in return it increases peripheral resistance. And you know that peripheral resistance increased contributes to increased blood pressure or hypertension. Second one, in endocrinal disorder, is thyroid diseases like hypothyroidism and hyperthyroid. Next one is pancreas. The disease related to pancreas is diabetes mellitus. In diabetes mellitus, there is atherosclerosis that promotes hypertension. Next one is Cushing syndrome. Cushing syndrome, there is increased functioning of adrenal cortex, and you all know what does adrenal cortex do. It releases cortisol, it releases androgens, it releases aldosterone. So if there is hyperfunctioning of adrenal cortex, uh, more aldosterone will be produced, and more sodium and water retention will be there, and in return it will be increased plasma volume of the body, and that will cause to increased venous return, and gradually that will cause hypertension. Next is Conn's disease. What is Conn's disease? It is a variant of Cushing syndrome, and in Conn's disease there is primary hyperaldosteronism. So you all know that hyperaldosteronism, what does it do? It increases sodium and water retention, increases plasma volume, increases venous return, increases blood pressure, and causes hypertension. But if there is a patient with hypertension and hypokalemia, because one of the function of aldosterone is to secrete or excrete potassium. So if there is hyperaldosteronism, it is retaining sodium and water, but it is also secreting potassium from the body. So hypertension along with hypokalemia is always Conn's disease. Next one in endocrinal disorders is pheochromocytoma. It is basically tumor of adrenal medulla, and adrenal medulla's activity is increased, and it releases adrenaline and noradrenaline, and that results in episodic hypertension. There's a point to note that all endocrinal disorders will lead to hypertension except Addison's, because in Addison's there is hypofunctioning of adrenal cortex, that is decreased cortisol levels, decreased androgen levels, and decreased aldosterone levels. Next thing that causes secondary hypertension is drugs. There are certain drugs that causes secondary hypertension, such as steroids, anabolics, OCPs, cocaine, amphetamines, and NSAIDs. Point to note is that long-term use of NSAIDs causes secondary hypertension, such as why it causes secondary hypertension, because NSAIDs inhibits prostaglandins, and prostaglandins are vasodilators. So if prostaglandins are inhibited, there will be no vasodilation, and in return there will be vasoconstriction, peripheral resistance will increase, and as a result hypertension will occur. Next thing is some congenital diseases, such as coarctation of aorta. What is coarctation of aorta? Coarctation of aorta is that it aorta constricts after giving branches to upper extremities. As a result, on examination, there is radiofemoral delay, and clinically, patient will present with less than 25 years of age with increased blood pressure. Next causes that cause secondary hypertension is obstetrical causes. Obstetrical causes, there is toxemia of pregnancy. Now let's talk about toxemia of pregnancy or pregnancy induced hypertension. So, the pathogenesis of pregnancy-induced hypertension is that in third trimester there is hypoperfusion of fetal kidneys. Why? Because of underdeveloped placenta. Because of underdeveloped placenta in third trimester of pregnancy, there is hypoperfusion of fetal kidneys. As a result, fetal kidneys produce renin, and that renin goes into maternal circulation, and that renin doubles the renin angiotensin aldosterone system. As a result, sodium and water retention doubles. That causes pregnancy induced hypertension. If we do not treat this pregnancy induced hypertension, that results in preeclampsia, and later on it causes eclampsia. Thank you.